Hey GPs, have you ever been in a scenario where you want to code correctly so that your diagnosis is accurate and you get proper reimbursement? Well, I want to let you know about a code that a lot of GPs don't even know about, and that's code 7241, which is also known as a complete bony with complications. Now, if you don't know anything about me, I'm Dr. Jared Williams. I am your third molar expert. And what we do, we train GPs with little to no experience to remove third molars proficiently in less than 4 weeks. So if you're a GP who's want to take their skills at next level, you're going to want to know about 7241, affectionately known as a complete bony with complications. All right, so let's jump into it. So, when you're going to be treatment planning cases, it's super important to understand how to code and to get the proper diagnosis. Because if you don't, you're going to be underdiagnosing, which is a problem, and you're not going to be getting the proper reimbursement for the work that you've done.
Are you a GP tired of referring patients out of your practice and losing out on production? Did you know third molar surgery is a $3 billion industry? If you are ready, join the 5-day third molar surgery challenge, which will give you the confidence, knowledge, and skills to remove third molars safely. During this challenge, you'll enhance your surgical speed and gain exclusive access to insider secrets that specialists for years have tried to keep hidden. By learning these techniques, you'll be able to serve more patients, add more skills, and be the go-to doctor in your area. Don't miss this incredible opportunity to boost your skills, increase patient volume, and revolutionize your practice. Enroll now and let's embark on this exhilarating journey together.
So, after doing over 12,000 surgical procedures, I've discovered that 7241 is not something a lot of GPs know about. So, if you look at my graph right here, we're going to specifically hone in to this area right here. So, complete bony with complications is basically when there's nerve involvement, sinus involvement, or it's in an aberrant tooth position, basically in a weird, funky place. And one thing I want you to be aware of, don't allow the name to make you disregard what's truly there. What I mean by that is this: it says complete boning. Now, if you look right here, this is also a complete boning. At least half the crown of the surface is covered with bone. But I want to let you know a 7241 can actually be fully erupted. And the reason why I say that is this: if you look at the definition, it says nerve involvement. And so when you start looking at nerve involvements, I want you to start thinking about how you're going to process these teeth. So let me give you a couple of examples so that you'll be clear on how to diagnose and how to spot a 7241 when it comes to your office. All right, so if you see here in this x-ray, these are one of the cases that was sent to me. As a concierge dental surgeon, I go to different offices doing surgery for different GP offices and even specialty offices. And these are some of the cases that come and requiring me to actually take these teeth out. So I would say this: if you haven't been trained, and I don't mean just going on YouTube and social media and just getting your training, but if you haven't been trained by an expert within third molar surgery, certain cases you just should not perform, because I would hate for you to harm the patient, end up potentially getting caught up with a dental board complaint and or getting sued or all the above. So let me just show you what a complicated bony can look like. So as you see in this bottom box right here, it would be considered of a complete bony with complications because it's sitting in the body of the ramus and it's buried pretty deep. Now you could see that there's nerve involvement present, but it's not something that is like intimately connected if you understand and you've been doing third molars for some time. Now understand that this is a little bit of advanced code, but understand this: if I expose you to something that you've never seen before, now you have the ability to be aware of it and know what to do. Also, if you look at this tooth right here, this would be an aberrant location because it's far up, high up, approaching and possibly inside the maxillary sinus. And so that would be a 7241 along with this one. However, here's your little tip before we get out of here. A 7241 could also look like this 12-year molar right here. Sometimes you could have a 12-year molar that is fully erupted and looks like a surgical erupted, but the nerve ends up running right past the apical 1/3 of those roots. And so if you remember that it says nerve involvement. So any tooth that has intimately connected with the IN, I want to let you know that code you can use as a 7241. Now, it was interesting. We were doing our 5-day challenge, and one of the doctors asked me a very good question. And he said, what happens if I end up seeing a tooth like a premolar or a first molar, second molar that's sitting in the sinus? He said, would I code for 7241? Well, I would say not quite. What I would do is I would code for a 7261. A 7261 is a special code. It basically is letting you know that you're probably going to have to repair the actual sinus once you end up doing a removal. So those are certain things I want you to be aware of when you're looking at coding your patients, specifically for third molars. Now, I know this code probably has never been talked about specifically in your training, specifically in dental school or just in residency, just for some fact that GPs typically won't see these types of cases. But I want to let you know, if you're interested in wanting to take your skills to the next level, you got to know these codes. And this is one of them. So if you ever see a tooth that's sitting in the sinus or that's wrapped around the the nerve, you know that the best code that you should use for proper diagnosis is going to be a 7241, which is a complete bony with complications that's in an aberrant position in the sinus or wrapped around the nerves. All right, guys, I'm Dr. Jared Williams, and that's your tip of the week. Remember, you deserve to smile after surgery. Make it a great one.